Okay, hold on 1 second. Oh, let's see.
You're live.
We're live. There we go.
Hi, this is Dr. Matzkin here at Allied Eye, and I'm observing social distancing and coming to you from my office far away from live patients to answer any questions that you may have about eyes, eye conditions, without any threat of infecting anybody with the coronavirus. So this is my little stand-in, but you know what? I think I'm going to brave it and come into the camera view myself. So here we go. Okay, so here we are at Allied Eye, and I've got a few questions from some of my patients that have called in. And where's my sheet of paper? I think this is it here.
Okay.
We come to you from difficult times. Everything's shut down, but we here at Allied Eye still able to see patients with acute eye problems, vision loss, issues related to lost glasses and contact lens difficulties. But one question, well, before we come to the questions, I've been asked to talk a little bit about common symptoms that occur at this time of the year related to the eyes. And we do see patients with a lot of watery eyes, itchy eyes, burning eyes, tired eyes, dry eyes, and all these itchy scratchies that we joke about in the office. But they're serious symptoms for you, and it's important to differentiate various conditions that can cause these symptoms. So people complain of a lot of watery eyes, and they've gone to other eye doctors and they've been told they've got dry eyes, which sounds a little weird. They've got dry eyes, but their eyes are watering all the time. So why does this happen? Well, dry eye, the tears that we produce have different components. So there are 3 different components in tears, and if you short of one component, then the eye tries to respond by producing the other components that are more readily available. So that's why the eyes tend to water more, but it's not a good quality of tears. So what we typically do, we'll supply an over-the-counter tear replacements. They're refresh tears, blink tears. There are probably 20 different kinds of products in the stores to supplement your poor quality tears with good quality tears. But that's if you've got watery eyes. Now some people have dry eyes and really are deficient of tears. They peel an onion, they at a bereavement, and they want to cry, but they just do not produce enough tears. And we can diagnose this in the office by doing a little strip test. We put some blotting paper in the lower lid for a few minutes, and we can tell very quickly whether you're producing enough tears. And typically you want at least 10 millimeters or half an inch strip of wetting to diagnose dry eyes. And indeed, if that's the case, we can put little stoppers in the corner of the lids here, right in the corner. They're little openings that typically drain normal tears into the back of the nose and the throat. And by stopping up whatever tears you're producing or whatever tears you're supplementing with drops, can keep the eyes nourished and more comfortable. Sometimes, most often we'll just do the lower lids, but sometimes in severe cases we may stop up the upper lids as well. And then why do people have dry eyes? Well, it's usually more common as we get older. The glands that produce the tears along the lid margin and under the upper lid and on the white part of the eye, the conjunctiva, they stop up. The blood flow isn't that good. Sometimes we take certain medications, diuretics, and other medications can cause dry eyes. Certain diseases such as autoimmune diseases, lupus, rheumatoid arthritis, those are notorious for causing dry eyes in patients, and it can be quite a bear to deal with. Sometimes we use prescription drugs to help the condition. sometimes there's inflammatory condition along the lid margin, like blepharitis, and that can aggravate the dry eye. And so we may give some cortisone drops for this condition. There are autoimmune or anti-inflammatory drops called Restasis that many people have heard of, and there are newer variations of that. They seem to work more effectively in patients with autoimmune disease like rheumatoid arthritis and lupus than the normal run-of-the-mill age-related dry eyes. The disadvantage of some of those drops, in my opinion, is that they take weeks or even months sometimes to have any effect, and some of these drops do burn, and of course they're very costly, and so the compliance with these drugs is not that great in my opinion, but certainly there are a few patients that benefit highly from using those drops. Besides dry eyes, we can talk a lot about dry eyes, but the other external issues, some patients just complain to me about, oh doc, my eyes are just feeling tired, I just have tired eyes, what's going on? Well, the first thing to do obviously is to examine the patient and see what's going on, and often we find that just the prescription is off. Your glasses prescription is not correct for you, and you constantly squinting to try to keep things in focus. So the first thing I do when I see a patient complaining of tired eyes is do a very, very careful refraction, checking the glasses prescription, both for near computer use and up close. And many people are sitting at a computer all day long, and they're squinting to see the computer, they're lifting their chin up as far as they can to use the sweet spot of the reading part to see the computer, and that just causes not only eye strain but neck strain if you're doing that all day long. So yeah, that's sometimes I may recommend a pair of dedicated computer glasses, and that often relieves all sorts of eye and neck ailments. And then again, tired eyes, glasses prescription, then the dry eye thing we need to look at, and then of course, certainly in Chattanooga, Tennessee, we have a lot of patients who've got pollen issues, and I was in the yard myself the other day and working in the yard, and my eyes just got so uncomfortable, and then I realized I was being hit by pollen, and I had to go indoors and wash my face and get all the pollen off my clothes, and found at the bottom of my drawer some old drops that I keep for such emergencies. So they're allergy drops, they're over-the-counter drops that are pretty effective. And if you do suffer from allergies, if we diagnose the allergy, which not only do you have a watery eye, but itch, you just constantly want to itch and scratch your eyes. You may sneeze associated with that, nose run. There are good over-the-counter drops that we recommend twice a day. If they're not effective, they're more beneficial, more helpful once a day drop that really is excellent. It takes away the itch immediately, and I found that myself very helpful. Sometimes that doesn't work, and we got to use breakthrough cortisone drops for breakthrough discomfort. So there are all sorts of remedies for patients who have allergies. I saw a patient just yesterday. She was rubbing her eyes like crazy, and the whole lower lid, both lower lids, were just so red and excoriated, and I could just envision her just rubbing and rubbing and rubbing and making the eyes all red. And she really came in, doc, she said, my lower lids just are so red, what's going on? I said, straight away, you've been rubbing your eyes. Oh yes, I've been rubbing my eyes, I've been in the yard. So we had to give her some cortisone cream, some cortisone drops, and some allergy drops, and I'm sure that will work pretty well for her. So that's enough about that. If you have any other questions related to that, you can certainly type your questions, and we'll come back to them later. I have a few interesting questions from the Facebook audience. Somebody asked me, how far along does a cataract need to be fixed? Well, the short answer is, if you come to me complaining about the fact that you can see clearly for distance and near, and glasses is not fixing that, and there's no other condition going on causing decreased vision, and we've got to systematically examine the eye to make sure that there's nothing else going on. If you have a complaint, that's the time we will talk about cataract surgery. But again, there may be reduced vision because your glasses are off, because your cornea is irregular or warped or scarred. You could have a form of glaucoma, you could have macular degeneration, or you may have a brain tumor even causing reduced vision. So we've got to really look not only at your eyes, but the whole neural pathway going all the way from the back of the head, the occipital cortex, through the brain to the front of the eye. So, but certainly these days, with our excellent, very safe cataract surgery techniques, we can really improve vision very safely, virtually overnight, to restore your vision. Many patients come to me with thick glasses, very far-sighted, very nearsighted, and they're complaining about their vision. Their prescription's been changing quite rapidly over the past few months or even a few years, and that's a good opportunity to get patients, instead of changing their prescription every few months, we get to the cause of the problem, which is the lens changing over time. We take out that lens, put an artificial lens in, and if I get a model of the eye from my exam room, we can show you on a model what a cataract is and what we replace it with. So we've asked Jamie to track down some little props that I can share with you.
Yes. We do have another question from a member of the audience. Virginia asked, what causes the macular degeneration?
Virginia, thanks for your question. That is a very interesting question, and many smarter scientists and doctors are looking at that constantly to try to find what is actually causing macular degeneration. What's really happening is the retina is just like any other part of the body. It's a metabolic process. Light is shone into the eye, and the retina has to process that, and it uses nutrients from blood and from the cells in the blood to process all that. There's a whole physiological reaction going on, and the cells have to undergo a regeneration, and they're toxic byproducts from the cells that the body has to get rid of. Just like the kidney has to get rid of toxic products in the bloodstream, so the retina has to get rid of toxic products from light transmission into the eye. Now, if the retina cannot get rid of those toxic products, they form what's called a little drusen, which we see in the back of the eye, and there's a change in the pigmentation. So there's a buildup basically of these toxic little products in little packs of drusen, and that progresses and can affect the retinal cells in the very center of your vision, called the macula. That part of the macular degeneration is called the dry form of macular degeneration. That can change and become what's called the wet form of macular degeneration. What happens is these toxic products kind of attract new blood vessels to try to get rid of these toxic products. So these new blood vessels grow in, and unfortunately they can bleed and cause scarring. And that's what causes devastating central loss of vision in the retina. And in the past 10 years perhaps, we have developed treatments to allow these abnormal blood vessels to regress. And that treatment entails regular injections into the back of the eye. Let's have that model here. Thanks, Jamie. So again, let's just talk. Can you see this in the image here?
Scoot up a little more, or just lean up.
There we go.
Yeah, there you go.
Okay, so this is the front of the eye. That's the cornea. Behind the pupil is the lens. This is the lens. This is the cataract that we were talking about earlier. This is the cavity of the eye called the vitreous cavity. This is the optic nerve, and right next to the optic nerve there's a little depression called the macula. So this is the area that typically gets affected with macular degeneration that we were speaking about. So these blood cells, in wet macular degeneration, these abnormal blood vessels grow in and cause bleeding and scarring. And what we can do is every month in patients who we identify good candidates, we can use a very, very thin needle, and we put the needle right through the eye, right next to, in this area, about 2 or 3 millimeters from the cornea. This is a very safe place to enter the eye, and we inject just a tiny amount of either Avastin or Lucentis or Nalea, and that causes probably about 70-80% of patients, these abnormal blood vessels that grow there, to regress and can either improve or maintain any vision that patients have. So that's a good treatment. Thanks for that question. Are there any other questions?
Yes. Laura asked, what causes eyesight to deteriorate as we age?
Well, again, the commonest causes of loss of vision as we get older is cataracts. Everybody gets cataract to greater or lesser extent as we get older. Macular degeneration is the other common one, and then glaucoma. Glaucoma is a little different from macular degeneration, where macular degeneration affects your central vision. Glaucoma affects the nerve, and typically in most kinds of glaucoma, your peripheral vision is very slowly diminished over time, and that's why we do regular visual field tests in patients who we suspect with glaucoma to try to pick up any defects. Unfortunately, we can't restore any glaucoma side vision loss. We can only prevent further progression once we identify it. And the thing about glaucoma is that it's painless, and you don't know you've got it unless it's picked up routinely on an eye exam, or you've lost so much vision that you come in complaining about difficulty getting around and being able to see what you want to see. The other thing that can cause visual loss as we age is stroke. We see patients, unfortunately, who suddenly develop a loss of side vision in both eyes. So either the left side of your body or the right side of the body that can cause it. In people who've got different kinds of tumors in the eye, press on the optic nerves and the central part where the optic nerves cross in the brain, it can cause side vision loss in both eyes. So those are probably more rare conditions, but mostly it's cataracts, glaucoma, and macular degeneration that you need to worry about. And that's why we encourage patients, certainly over the age of 40, to come in at least once a year to check for these conditions, because they are treatable.
Okay.
What else have you got?
Next question is conjunctivitis associated with the coronavirus.
Well, that's a very topical question. Whenever you get a fever of sorts, whether it's from flu or just a nasty sinus infection, the eyes tend to get watery and red, and it's no different with the coronavirus. Patients unlikely to present to me, to the ophthalmologist, with coronavirus just by having red eyes. Firstly, they're going to have a fever and a headache, and then they'll develop the red eyes. But it's not something that we typically see. If you've just got a conjunctivitis, if you've got red eyes alone and otherwise perfectly well, it's unlikely to be corona. Interestingly enough, the coronavirus in China was first reported by a concerned ophthalmologist who believed he got coronavirus from an asymptomatic patient who had glaucoma, and he was checking the pressure in the exam room, and 2 days later he got very sick, and he actually subsequently died, and he's known as the whistleblower in China for publicizing the coronavirus epidemic and making the world aware of this condition. But I hope you're all staying at a socially appropriate distance from your work co-workers and your family, and keep this thing contained, because we're all very worried about this condition. But from my understanding, things are looking a little bit better with the less number of cases being reported generally, and certainly in Hamilton County, which isn't as dense as New York and other big cities. We feel a little bit safer, because we're a little bit more remote, and we like it that way, and we certainly want to keep it that way.
Okay, good. We have 3 more questions.
Okay.
Let's see. How often do we need to see an ophthalmologist for a thorough eye exam versus an optometrist?
Well, our training is a little bit different. Optometrists do a very good job in screening for eye diseases, the diseases that we mentioned. Ophthalmologists are MDs, and we have medical and surgical training, so we see things from a slightly different perspective. For example, patients who've got declining vision, who are generally seen by an optometrist every so often, they're more likely to get a change in glasses. As a surgeon, we like to talk about surgical options in certain patients. If you're concerned about glaucoma, the optometrist is able to prescribe drops, but he won't be able to offer you a laser or other option for treatment, etc. So any eye professional is an excellent option for you to get screened. Just understand that an optometrist is a very good screener of diseases and can treat up to a certain point. Ophthalmologist is certainly more trained in pathology and surgery fields.
Okay.
Yeah.
Next questions. Let's see. What precautions is Allied Eye taking against COVID-19, and are you offering telemedicine?
Well, from the very beginning, we have been concerned about rapid spread amongst our co-workers and patients. So from the very get-go, we did not stop seeing patients, but we eliminated patients waiting in our waiting room. So patients would stay in their cars, and we'd call them in one by one to be seen in the office. All my staff wear masks, and we won't see any patients in the office who are not wearing a mask of some sort. Between every patient, the equipment is thoroughly wiped down with appropriate products, and also gloves are worn where appropriate. We also screen all the patients with temperature as soon as they walk in the door. So we ask also if they've had a temperature, if they've been in contact with anybody who may have been in contact with a COVID. Well, I think that's about all we're going to talk about today. This is my first FaceTime live experience, so it's a little unusual for me to chat to a camera, but I want to thank Catherine and Jamie for setting this all up, and they've been very encouraging. The best part about this is being able to use my little prop, which I got as a birthday present. It was a birthday or Christmas present a year or two ago.
I believe birthday.
And I got my office cleaned up just for this event. And I just want to say one other thing. I want to thank Callie. She's my daughter, who's been a great help in getting COVID. I should be further away from you, Callie.
Yes, you should.
But her and my wife, her mom, have been making these masks at home, and they're doing it at a rapid clip. So many of our patients have asked where I get my mask from. My mask is in my jacket pocket. But Susan is making masks at home. If any of you are in the need for a mask, please call my office, and we can arrange for Susan and Callie to make you some masks. They're not very expensive. They're just recharging for a little bit of the material and the time and shipping. If you want to ship to anywhere, we can arrange for that as well. So Callie?
Yes.
Thank you so much for coming to show off your mask.
Thank you. Thank you for having me.
Oh, it's such a pleasure. Okay, goodbye everybody.
Bye. Thank you.
Okay, bye-bye.